Hello, welcome to this brief overview of the use of Narcan or naloxone for the reversal of an opiate overdose. Next slide. Today we'll be learning about some basic information related to the overdose problem in the United States and Illinois. We're going to also talk about the fact that we can use this product without any fear of legal repercussions. We'll discuss briefly how opiates work, and then also how naloxone works to reverse an overdose. And we'll spend the bulk of our time, and the most important part of the video and recording here will be about how to identify an opiate overdose and how to respond to that overdose with the administration of Narcan or naloxone. Next slide. Some background information related to opiate overdoses and opiate overdose deaths and opiate reversals over the last several years is shown in this slide. We can see here with the green dots that opiate overdose saves have been increasing steadily over the last several years and have evened out the last couple of years, but I've seen how opiates have been affecting the community while those saves have been occurring. You can also see in this slide that many of the deaths related to opiate overdoses is not just from heroin, it is also from the combination of heroin and fentanyl becoming more of a problem with the opiate overdoses. Next slide. This is a demographic slide showing the breakdown of who is affected in this community in DuPage County. A vast majority of those who are overdosing are males and white. Also, the age ranges are finding themselves more split than they used to be in the past. There'd be more numbers in the 19 to 29 age range, but currently there are more people overdosing in the over 30 age range as well. Next slide. This is an interesting slide that helps to reinforce the use of Narcan in the community and the importance of having it in as many people's hands as possible, in that many opiate overdoses occur in homes and apartments. The sooner an opiate overdose can be reversed, the better for the outcome. And so those who have Narcan available in their homes or apartments are, of course, there first before the police or the paramedics. Next slide. The solution to addressing the opiate overdose problem in this community certainly would lie with abstinence, in that non-use of an opiate would certainly lead to no overdoses. However, the reality is that many people are struggling with opiate use and abuse. Naloxone or Narcan is a safe and effective way in which to reverse opiate overdoses, and that it gives an opportunity for people to get help and to make the necessary changes in their lives. It's important to note that naloxone does not affect overdoses related to other substances. It only works on opiates. Next. So opiate overdoses can be prevented in that with the use of naloxone or Narcan, and that first responders and bystanders have the capacity to use this product. As I mentioned, it is important for the possibility of a person to be able to come back from an opiate overdose, in that many times it takes many times for a person to make the necessary changes for abstinence from a substance use issue. The more opportunity a person has, the more likely then they are able to make the changes in their life that they would like to. So Narcan is a safe and effective way in which to save lives. Next slide. The next several slides here include an outline of how and why we as bystanders and lay people can give naloxone as a way in which to reverse an opiate overdose. Naloxone is safe and effective. The state of Illinois, as well as many of the other states of the United States, have made it a law that if in good faith the person utilizes naloxone to help a person who they believe is overdosing on an opiate, and there is a negative outcome, that there is no prosecutory means to which to follow up with that a person is safe to give this in good faith without fear of punishment. Next slide. Naloxone helps to reverse an overdose by knocking opiates out of the receptors in the brain, and therefore allowing it to block other opiates from getting in the receptors and stopping breathing. Narcan allows a person to resume breathing after an opiate has stopped their breathing. Narcan is helpful for all opiates, but opiates are not all of the same strength or potency. Several different opiates are on the market, both legal and illegal, and they have relative strengths of potency, from codeine at the minimum to fentanyl and carfentanil at the maximum. This is important to note in that if a person receives a drug or medication that is stronger than what they had anticipated, there's a higher likelihood of overdose. Next slide. Risk factors that contribute to an overdose. These are the things to look for to and be aware of in relation to helping someone so that you can be prepared if there may be an overdose. A person's individual tolerance is a risk factor. A person can build up a tolerance to a drug over time. At times when a person's tolerance lowers, like after jail or a time in detox or rehab, their tolerance is lower than they anticipate. A person would then use a substance that they thought they would have the tolerance for and then overdose. Mixing substances, especially substances that are also central nervous system depressants, leads to greater likelihood of overdose. Also, on the opposite side with stimulants, a stimulant can give a person a false feeling of being more alert than they are, and then have the opiate overwhelm them and stop breathing. The next several are common sense ways in which an opiate overdose is likely: poor health, previous experience, someone using alone, and finally the one with the changes in strength, and that many times the street drug is not what the person who's purchasing it believes it to be, and could be stronger than they thought. Next slide. This slide shows the difference between someone who's really high and someone who is overdosing. It's important to note that the use of Narcan is for those who are in overdose. The bottom line takeaway from this is that a person in overdose is not responsive to an attempt to awake them. So doing a sternal rub, saying their name, shaking their shoulder, a person in an overdose will not respond. A person who is really high will respond. If you encounter a person who is not responsive, that is an overdose, and utilize Narcan. Next slide. Please watch this video for a demonstration of the use of this product.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children.
It's important to note from the video that once the Narcan is administered, the emergency is not over, and that the calling of 911 emergency paramedics is important to follow through with. It's also important to know that there is a training guide within each of the doses that are used, so please review that if need be. Next slide. This is the recovery position after providing the Narcan or naloxone and a person starts to breathe again. It is useful to move them into this position as it helps them in their recovery. Next slide. If you have any further questions about opiates, opiate overdose, or in finding help related to substance use and substance use disorders, please go to hopedupage.org. It has the Illinois Opioid Helpline number, as well as other interesting menus in which to see how Narcan has been useful in the community, as well as other resources for substance use treatment. Next slide. there are any questions, please check out the FAQ video, and please feel free to contact the health department, DNP at DuPageHealth.org, for any other questions. Thank you.